In today's video, we talk about breast abnormalities. We want to know what the possible causes are and what the best approach is to take in case you have one. Hello everyone, welcome back to my channel. Thank you for clicking. So talking about breast abnormalities, in this video I want us to do it this way. I'll first bring out what a normal breast should be like, and then I'll give 7 common breast abnormalities, and concurrently I'll be giving what could be causing them, and then also the approach to take in case you have that particular problem. End of the video, I'll bring out the red flags for breast malignancy, which you shouldn't overlook. Okay, talking about the normal breast, a normal adult female is expected to have 2 breasts occurring bilaterally, one on either side. And usually these breasts, the size differs depending on genetics, and shape differs. So I will not dwell into that. Superficially, when we look at it from outside, we expect to have a nipple which protrudes outwards. We expect to have an areola, that is the central pigmented part around the nipple. And then you also expect to have fat pad that is covered by overlying skin. Since some of the changes occur inside, I'll move a bit into the inside. It sits on the chest muscles, and it's made up basically of fat. Fat makes the majority of the portion, and then we have fibrous tissue. You know, that thing that forms on a wound, a scar, fibrous tissue. So in the breast we have a lot of that, and some of the problems that we shall see are affecting fibrous tissue. Then we have ligaments in it. Ligaments basically are those structures that keep the breast in position. So in sagging, it's because of the ligaments overstretching and the fibrous tissue. Then in addition to that, we have that system that is responsible for breastfeeding. And this is a bit complex, but I'll simplify it a bit. Its smallest, like the smallest particle of the breast is called the lobule. Now within that lobule, we have alveoli. I know you've had alveoli in the lungs. We have alveoli and acini, also called the small milk ducts. So for each lobule, it comes together with other lobules to form a lobe. And lobes in the breast are about 15 to 20. And all of these have the larger milk ducts, also which we call the lactiferous ducts, that will move and drain via the nipple. So other than that, the breast doesn't work independently. It works with some hormones. And some of our problems are because of the hormones. We have estrogen, we have progesterone, and we have prolactin. For estrogen, it will help the ducts to grow at puberty. And then for the progesterone, for it helps the alveoli. We talked about alveoli in the lobule. It's what will help them to grow at puberty. And then prolactin, for it stimulates milk production. In addition to those 3, there are other hormones that will come in, like oxytocin for milk letdown, growth hormone accelerates growth at puberty. That now that we've understood that, we are going to the changes. The changes, I'll start with changes with problems with size. You may be having a problem of small breasts for age. You expect that at a particular age, maybe they should be bigger than what they are. So what I would advise there is usually you to go to the hospital, and then they get your hormone panel. They try to check your hormones, because sometimes the breasts are small because of underproduction of estrogen, or sometimes estrogen is not produced at all. So that's what you want to see. If at all that is the case, most especially if you're still in puberty, usually we want to go in for the oral contraceptives, because these drugs have estrogen and progesterone, and then you take them for some prolonged period under supervision of your health worker. So what about the hormones seem normal? Usually there we think it's a developmental defect. And for that case, we don't now use oral contraceptives because your hormones are normal. Rather, what we want to know is, are your menses normal? Are you having your menses for maybe 3 days every month, a normal flow? If your menses are normal, we suggest that you just make sure you live a healthy lifestyle. You may not have a big thing to do. However, in future, that's when now breast augmentation comes in, whereby you go, usually it's under plastic surgery, where you go and then the breasts are increased a bit to the size that you're comfortable with. It's kind of costly, but sometimes it's worth it. I'm coming back with breast abnormality number 2. Change number 2. I'm going still on size. I'll talk about huge enlargement. It's a case whereby maybe there is overgrowth at puberty. Then, or maybe after breastfeeding, because usually breastfeeding comes with stretching of the fibrous septa, the fibrous tissue. So sometimes the breast may enlarge more than what you wanted, or sometimes pregnancy. The good thing with pregnancy, they tend to go back. After delivery, the hormones is lower, and then all the changes resolve. And then, but then for lactation, also some resolve. I know they come with a lot of discomfort. They'll come with back pain, neck pain. The option around is surgery. To call reduction mammoplasty, where we'll go and reduce the size. It's both under plastic surgery, but even general surgeons have done it. So provided in any country you're in, you could reach out to your nearest facility talk to your surgeon, they can help you schedule a day, and then this is done. Going away from that, I'm coming back with abnormality number 3. Number 3, I want to talk about unequal breasts or symmetry. So this sounds normal. Any female knows that breasts are not equal. So that's true. Usually in the early age, they have a big difference. With time, most especially after your menses, breasts tend to do what? To slightly equalize. However, usually the left breast remains slightly larger than the right breast. So if you have unequal breasts, I want to tell you it's not a big deal, except if it's exaggerated. We have to also go and do breast augmentation. So that's also under plastic surgery. Abnormality number 4. And this is breast pain. Breast pain is quite common. Yeah, most of us females have experienced it once in a time. If you're experiencing breast pain, this is what you need to do. We want to look out for the timing. You see, this breast pain, we have it in types. We know we have what we call cyclic pain and non-cyclic pain. And cyclic pain characteristically comes towards menses, and it will resolve after menses. Usually it may occur in both breasts and may get severe at some point, but it gets relieved after menses. So I want to inform you that that kind of pain is normal. No need to worry. When the time when it's severe, you could take a painkiller. Yes. However, if you have the pain that is occurring throughout the month, it's dull. Sometimes it may not occur all days. It may come various days, but it comes when it's so severe, severe and on and off. If it's that kind of pain, I would advise that you go visit your doctor, because now the worry there that we have is statistics have shown that about 5% of breast cancer cases actually start with pain. So we don't want to ignore the pain. If it's cancer, you start early treatment. If it's not cancer, killers can work. You see, there are some drugs which give us side effects of breast pain. Yes. So if you're on drugs like oral contraceptives, if you're taking antihypertensives, if you're taking drugs like spironolactone, fluoxetine, these drugs, they are most likely going to give you breast pain. So still a painkiller here can work. Or maybe if it's too much, you could visit your doctor who started you on those drugs to revise them to a different. I'll move to the 5th. For the 5th and 6th abnormalities I'll talk about are related, and those are breast lumps. So these breast lumps differ. So if you have this breast lump, whereby the shape can easily be detected, like you can easily detect its shape, it's a bit firm. See a balloon. If you got a balloon and a piece of wood, each has a different feel, right? So if you have this mass that feels like there's no fluid in it, like it feels firm. So if it has a particular shape, it feels firm, and commonly it's not associated with any pain. You're thinking about here, it's either fibroadenoma or a malignancy. We usually want, in that case, you go to the hospital. Usually we do a mammogram. Mammogram, you just put your breast between this instrument that will help us to visualize, because sometimes some lumps actually are not visible. So when we visualize, we are able to see the lump exactly where it is, and then we are able to pick a piece of tissue from there. Go look at it under the microscope. And under the microscope, that we can easily see the cells. The cells are the ones that can tell us this is a malignancy, this is not. So that's how we even diagnose breast cancer. Even in uncyclic breast pain, for the fibroadenomas, if you realize it's a fibroadenoma, the good news is 35% of actually these fibroadenomas tend to disappear. 10% will just reduce in size. However, if it's too large, because there are some fibroadenomas that will be so large in that they even distort the shape of your breast. Usually there we advise that you go for surgery, they can excise and remove it, because they are in a capsule. Like you can pop it out. Speaking about the 6th abnormality, and that is the cystic lump. Usually for this one, it's associated with pain. You have a lump in the breast and it's painful, and this pain is occurring throughout the month. Worsens some days, maybe also on and off, or it may occur throughout the month. So for that kind of lump, the body maintains a certain ratio for estrogen and progesterone. When there is a mismatch or alteration in that ratio, that's when you start getting this. Or sometimes when your progesterone levels decrease, or if your breast tissue is overly sensitive to prolactin, you're most likely going to get this kind of cystic mass. What we want to do is, for these ones, we don't judge immediately. We want to do mammogram first. Because you know what the mammogram will do? It will help us locate it, we'll pick tissue, again view it under the microscope, and there are some cystic masses which have their characteristics that make them easily transform into cancers. So that's what we want to see. Look at them, there are some features on the nucleus. This is what we call nucleotypia. So if we have this cystic mass with nucleotypia, that one has a high risk of turning into a malignancy. So it has a different intervention. Likewise, if it's not having nucleotypia, now there you're safer, still it has a different intervention. If you feel such a mass, I would advise that you visit your doctor, and then this evaluation is done. I hope that is clear. And maybe before we proceed, I encourage you to subscribe to the channel. You can like the video for more weekly updates, such that you're informed every time I make an upload. Abnormality number 7. I'm talking to a person, if you've had this discharge that came out of the blue and it's persisting and it's not related to breastfeeding. So in that case, the first step you have to do is to visit your doctor. You know why? Because these different discharges communicate different things. Usually, if it's this discharge that is milky, like the one of breastfeeding, usually we think you could be having a breast condition. It's what we call galactoria, which also has ways to manage it faster, which you may not manage on your own. And then sometimes also oral contraceptives or the contraceptive pills come with that side effect of the milky discharge. The different colors, I'm going to talk about 7. The different colors tell us differently. Yet if it's not milky, if it's clear or watery, it communicates to duct or cancer. You remember the ducts I talked about? If they're getting a cancer in them, most likely you're going to have a clear or watery discharge. And then if it's serous, I mean, if like oily, this one communicates to a possible fibrocystic change, yes, maybe a broken cyst or something around that area, which also you have to visit your doctor to manage it. And then if it's purulent, we think we have an infection of the breast like mastitis, which needs to also be managed. If it's greenish yellow, sometimes it's because of a condition called ductactasia. Then if it's bloody, now that is a very big red flag for malignancy. The red flags for breast malignancy, which you have to look out for. So I'll talk about 6. Having any of these, please don't keep them. Visit your doctor as soon as possible such that you're given immediate attention. So 1, I'll start with the nipple. Ideally, the nipple, I told us, it projects outwards. If your nipple starts projecting abnormally inwards, it'll be a red flag. Then if you have a nipple discharge, just like I just said, a bloody one, it could be a sign. And then if ideally the nipple is supposed to be oily and very nicely kept, if it starts crusting or eroding, that could be a red flag. And then moving out from the nipple, the areola rarely gives us symptoms. Moving to this other fat pad, if you get a lump, and for breast lumps, for breast cancer, in most cases they appear in the upper outer quadrant. What do I mean? You see the breast is divided into the upper part and the lower part, and then it can also be divided like this into the inner part and the outer part. So if your lump is up and outwards, so that is the upper outer quadrant, is a red flag. And then if at the area of the lump we have a red discoloration, and then or if we have a dimpling, like the skin moves inwards, or sometimes when the entire breast may show a lot of dimples, like an orange peeling, how it looks like. If your breast looks like that, that could also be a red flag for malignancy. So don't keep those. Check out with your health worker. So basically that's what I had to talk about breast abnormalities. I hope it's of help to you. In my next video, I'll show you how to do this self-breast examination such that you're able to locate all these things, because we don't need to wait for the health worker to do this. We can do them on some of these things, like the self-breast exam. We can do it on our own using the right technique and the right timing, and we shall be good to go. Thank you so much.